The overturning of Roe versus Wade has many concern that millions of people's health and overall well-being is now at risk. I'd like for you to meet Dr. Danielle Mathisen. The SCOTUS decision not only impacted her career, but also her personal life. This is her story.
My name is Dr. Danielle Mathisen, and I'm from Fort Worth, Texas. As an OB-GYN, my job is to help women in every medical aspect of their lives. However, my schooling in Texas prevented me from receiving the proper training and education in family planning counseling or procedures due to the state's negative stance on the topic. Now, medical students studying under these restrictions will have to resort to filling in these gaps on their own. My colleagues and I needed to create an off-campus after-hours club that allowed us to study the curriculum that wasn't offered to us. There's already a shortage of OB-GYNs, and with the recent overturning of Roe v. Wade, thousands of people will not have access to the necessary care they need because there will be even fewer trained medical professionals where they live. An innumerable number of lives will be at stake. Everybody deserves access to healthcare.
Hi, sir. Thank you so much for having me and for speaking about a topic that is so polarizing, and doing so publicly truly means a lot to the OB-GYN community and anybody who's affected by abortion care. So thank you for having me. You announced earlier that the first piece of legislation you'll send to Congress after the midterm elections will be a bill codifying Roe. What is your plan to protect abortion rights over the next 2 years if Democrats aren't able to increase the majority in Congress?
Well, first of all, it's the first time the Supreme Court has, in fact, made a lot of decisions. It's the first time they have not only not proclaimed a constitutional right, but one that they acknowledge existed, taken away. And it goes beyond potentially the right to choose. What I have done is by executive order, what I'm able, I don't know the votes, but by executive order, what I've been able to do so far. And that is, for example, making sure that a woman seeking to choose getting health care across a state line that permits abortion, that in fact from one that doesn't, like Texas to another state, that they are able to do that. They can't be held accountable for crossing the line. Making sure that you cannot, making sure that women who are being looked at as to whether they might seek an abortion, that they're not able to be followed on their accounts so that they can know where they're going. Making sure that there's access to a number of items that accommodate availability of OGBYN help for the health of the mother in the states that still permit choice under Roe. And so there's a lot of things I can do by executive order. But when I said, and when you heard me say that the first bill I will send, if they give me the votes, I need a couple more senators and I need to maintain the House. The House will vote, the House of Representatives will vote to codify Roe v. Wade. Because, you know, senators have on the Republican side made it clear the first thing they want to do, Senator Lindsey Graham of South Carolina, wants to federally pass a law that they'd expect the president to sign that would in fact outlaw the right to choose, and in most cases, no matter whether it's incest, the pregnancy consequence of incest, or rape, or any criminal act. And he wants to codify that so that you can't have these choice in any state. I think if I have a few more votes, I'm going to be able to do that and get the Democratic Congress to pass this, and I will sign it. But if we don't do that and the Republicans succeed in blocking abortion in every state by passing a federal ban on it, then I'm going to veto it. It's not going to happen as long as I'm president.
Duly noted, sir. I really appreciate that support. Pregnancy itself can be a very dangerous and life-threatening condition, and there are countless ways a pregnant person can experience these. But in a state like where I'm from, doctors are often asked to wait for their legal counsel to allow them to perform life-saving abortions, even in the case of medical emergency, stripping that decision away from the medical professionals and putting it into the hand of lawyers. So my question for you is, apart from codifying Roe, is there more that can be done to protect our ability as providers to have the final say in what we think is best for our patients?
It's being contested in the courts, but I've passed an executive order saying that you can't do that, where the health of the mother is in question. Whether, for example, some pregnancies are not able to be terminated where the parent wants to keep the child. It is too dangerous to go and ends up with a miscarriage. And so what we have to do is just make the case to the American people, and I don't think it's, look, the Supreme Court ruling said, and I'm paraphrasing the line in the court saying that because this is a state issue, not federally guaranteed, women can vote. Facetiously, women can vote. Let's see. Well, guess what? I'm counting on you voting in big, big numbers like happened in Kansas. Kansas overwhelmingly turned out a very conservative state saying, no, we're not going along with that law that bans abortion and bans it under any circumstance. The other thing that worries me are two things. One you said and one you didn't say. How many universities around the country are like the university? Did you go to West Texas, or did you go to, what was the university?
I went to a university in Dallas.
Okay, I won't mention it then. But how many have that same rule where they don't teach you OGBYN about the health and safety relative to pregnancy?
Pretty much across the board, whether it's a private or public institution, just out of fear that that's somehow aiding and abetting achieving an abortion.
I didn't realize that was the case. I'm going to check it out in most states, because it's very worrisome. It's an example of what the Dobbs decision is doing. The Dobbs decision is putting an incredible amount of pressure on doctors to not take and make judgments that really do affect the health of the mother, unrelated to whether or not it's really related to abortion. For example, the case of a 14-year-old girl trying to get access to medicine relating to rheumatoid arthritis.
Yes.
And she goes, and for years has been getting it, her mom buying it, go to the counter. Drugstore said, I can't sell it to you because they're worried they'll be sued. They're worried they'll be sued. There's a lot of unintended consequences as well to this Dobbs decision. And so I admire the heck out of you for being willing to get together with other students and teach yourself. I mean, I'm curious, how'd you do that?
A papaya is a very good representation of a uterus, and you can practice on the papaya fruit.
But who was teaching the practice?
An outside physician, not a part of our institution, would come in and teach us.
Gotcha.
Yeah,
God
she's
love
wonderful. On a more personal note, I had to travel about 600 miles and leave my family behind and spend thousands of dollars to get abortion care for my own very wanted and very loved pregnancy. In the wake of Roe, some companies are offering funding and services for trips like this. Would you support a federal fund for individuals like myself who need to take time off work, obtain child care?
The answer is absolutely. But guess what? We need the same votes we need to overrule to reinstate the decision that was struck down by the court. I mean, I do support that, and I've publicly urged companies to do that. I've urged them publicly as President of the United States, saying, this is what you should be doing. I urge you to do it. Because there's so many, and imagine the women who need that kind of assistance but have no money at all to be able to do this. None. What do? They don't have the option. Our success relative to the rest of the world in terms of the number of mothers who die in pregnancy is so high, especially among the poor in our country. Anyway.
It's very disproportionately affected based on your socioeconomic status, and I appreciate you highlighting that fact, sir.
Thank you.